The new now, non-mydriatic automated confocal stereoscopic fundus photography. My COVID-19 buddy, no financial disclosure. When Corona happened in India, we at our center converted our previous waiting hall into an outpatient department and investigations cubicle. All the instruments were brought into one common cubicle to reduce the patient's movement inside hospital premises. This is a picture of the pre-COVID waiting hall, which is now converted into an OPD and investigation cubicle. By bringing all investigative modalities into the transparent acrylic cubicle, the risk of virus transmission was prevented during doctor-patient interaction. The cubicle was provided with sliders which closes the openings when the investigative test was not performed. A leg rest was also provided for patients' comfort during the investigations. Moving on to my COVID-19 buddy, the EDON confocal scanner. It is a non-mydriatic fundus scanner with unsurpassed image quality with 60-degree field in a single exposure. Total examination time takes approximately 30 seconds for both eyes cumulatively. Simultaneous visualization of both funduses are possible for a good comparative examination. The prototype pattern we propose here is have the slit lamp and the fundus scanner positioned side by side. Now, with the help of local area network, the fundus images on the scanner can be relayed to a PC desktop near the doctor's slit lamp for a detailed zoom examination without pixelation for better diagnosis. Let us see the workflow in a real-time video format. A patient with non-mydriatic pupils are examined by the scanner. It begins scanning once the data is fed into it. Scanning principle followed are localization and segmentation. By localization technique, the optic disc position is identified where the four major vessels converge. Then, with segmentation technique using the circular hook transform concept, the cup is segmented out from the disc. Once the right eye is scanned, the machine automatically shifts to the left eye. Once the scan is completed, the patient is directed towards the cubicle where the doctor is present with the slit lamp. A short history is elicited, followed by anterior segment examination by the slit lamp, followed by examination of the fundus images relayed from the scanner through LAN in the PC desktop. Simultaneous comparative examination of both eyes are possible in high resolution with zooming tool. Sterilization is done with sterilium, where the headrest and chin rest is first cleaned, followed by cleaning the sides of the cubicle opening to prevent virus transmission. The leg mat can also be cleaned intermittently. The factors challenging a good 90-day examination of fundus: 1. Doctor may accidentally touch the patient's face or mask. 2. Poor visualization of fundus due to face shield preventing good stereoscopic view. This is a real-time situation of 90-day examination where the doctor tries his best to prevent his hand from touching the patient's face or mask, but ends up inadvertently doing so to get a good view. A study was conducted to evaluate the outcomes with the automated non-mydriatic confocal scanner. Aim was to evaluate the quality of the non-mydriatic image. Also, the effectiveness in diagnosing the pathology was evaluated. 831 consecutive patients were screened with EDON confocal scanner. Out of the 1,662 eyes, 123 eyes were excluded due to logistic reasons such as ACCO, uveitis, foreign body, hordeolum, bullous keratopathy, and so on. One such patient with back issue was also excluded. The quality of the images were classified based on even illumination, good focus, absence of bright artifacts that is white noise, absence of dark artifacts that is black noise, image acquisition signals influenced by the pupil size and media opacities like cataract, and classified into good, medium, poor, and no image. This is an example of a good quality image showing central retinal vein occlusion. This is a good quality image with no white or black noise showing a beautiful CSR on zoomed view. This is a medium quality image with black noise in the left image and white with black noise in the right image. In a poor image, the area of black noise or white noise occupied more than 50% of the image area. No image was defined as one in which 90% of the image area had white or black noise. Total eyes screened were 1539, out of which 1079 were good quality images and no image acquisition was possible in 129 eyes. So basically, 70% of them were good in quality, 16% of them were medium in quality, 6% of them were poor in quality, and no images were obtained in 8% of them. The pupil size was compared with the image quality and it indeed had a correlation. When the pupil size was bigger, the image quality was better. When the pupil size decreased, the quality of the image also decreased, as elicited by the decrease in height of the bars from left to right. For example, in right eye, average pupil size was 3.2 mm in a good quality image and decreased to 2.3 mm in a poor quality image. Why no imaging was possible in 129 eyes where 76% of them were mature cataracts and 24% of them had small pupils less than 2 mm. Of the remaining 1410 images, 88% of them were normal and 12% of them were pathological. Out of the 12%, that is 174 pathological eyes, the common conditions were NPDR, glaucoma, ARMD, and PDR. Overall, 29% had NPDR, 12% had glaucoma and were on treatment, 11% had ARMD, 9% had PDR with PRP, 6% were newly diagnosed glaucoma, and 5% were newly diagnosed PDR. Last but not least, by interconnecting the Fundus scanner to the PC through local area network, we can also email the patient their soft copy. Also, a soft copy can be attached to the patient's phone with the help of Bluetooth. Thus, the patient will have the best copy, that is, soft copy with them for future reference. Practical application in clinical practice. In this video, I have shared few of my glaucoma cases imaged with a confocal scanner, starting with diagnosing and differentiating a suspect from a glaucomatous disc. This is a case of advanced glaucomatous cupping in both eyes. With the help of an inbuilt software, risk profiling the glaucomatous disc by a cup-disc ratio measurement tool is objectively possible. The resolving splinter hemorrhage in normal-tensive glaucoma patients can be periodically followed up with precision, as shown here. Structural and functional loss correlation is possible. For example, a superior notch seen on the right can be compared to the polar analysis loss on the visual fields of the octopus functionally seen on the left. With a confocal scanner, patients presenting with dense cataract with poor quality images can be enhanced and glaucoma diagnosis can still be made with accuracy. Thank you.